My name is Kate Erickson. I'm the Opioid Overdose Prevention Director. In Minnesota, drug overdose deaths are increasing, and there are significant racial disparities in drug overdose death. MDH Injury and Violence Prevention Section was awarded a grant from the Centers for Disease Control and Prevention called the Data-Driven Prevention Initiative. Mark Kindy and Dana Farley wrote the grant and then hired me, Kate Erickson, as the Opioid Overdose Prevention Director in January 2017, and Nate Wright as the lead drug epidemiologist a few months later. The goal of DDPI is to increase the timeliness, accuracy, and utility of opioid-related data to prevent overdose deaths and to inform prevention initiatives. MDH created the Opioid Dashboard, a one-stop shop for opioid-related data. Under each indicator section, there are 5 tabs: narrative, source, analysis, resources, and prevention. So it's data, but it's a lot more than that. It's information, context, and resources. The primary audience for the Opioid Dashboard is anyone that's working on substance use disorder and overdose prevention. We did market testing in July of 2017, and then we launched the Opioid Dashboard in October of 2017. Development included research, interviews with subject matter experts, partner engagement, market testing, and ongoing analysis of multiple sources of data. Before we even started working in the development site on the Opioid Dashboard, we met with partners to talk about what they needed in terms of content and layout, and then we reported back to them about how their ideas were incorporated into the project. We created content for many subjects, and then dissemination is ongoing and includes multiple communication channels, press conferences, earned media, webinars, videos, and a number of journal articles that were published as well. Evaluation and quality improvements are ongoing and include a weekly action-oriented team meeting, a multi-sector data review team, Gov delivery and Google Analytics, and presentation evaluations. As a result of the work with the Data-Driven Prevention Initiative, we have a greater understanding of the opioid epidemic in Minnesota, and we're moving towards a shared understanding, a shared narrative about what needs to be done to save lives, address the harms that have already happened, and prevent harms from happening in the first place. We've developed and enhanced partnerships. Some of our external partners include human services, public safety, tribal government, medical examiners, poison control, faith leaders, and employers, just to name a few. And we've had the opportunity to work with many of our MDH colleagues as well: OSHE, IDPC, OHIT, Emergency Response, the Lab, Oral Health, Office of Health Equity, Health Policy Division, and Communications. For example, we got to work with the SHIP grantees who are working on implementing prescribing practices, increasing access to naloxone, and safe disposal of unused or expired medications. We also got to work with the All Payers Claims Database team to replicate the new chronic user measure. We're integrating multiple sources of data: hospital data, death certificates, Minnesota Student Survey, EMS, the Bureau of Criminal Apprehension, Prescription Monitoring Program, and Infectious Disease. And we've had 4 press conferences. The first was the launch of the Opioid Dashboard, the naloxone protocol, updated data, and then our last one was on the Opioid Epidemic Response Employer Toolkit. Just that press conference reached an audience of over 800,000 viewers. We have had 40,000 visitors to the Opioid Dashboard. While we're honored and thrilled to have that many people come to the Opioid Dashboard in the first year between October 2017 and October 2018, we also know that the reach is much greater. When we meet with the health licensing boards, each of them serve thousands of providers and communicate with thousands of providers. Or if we meet with the regional prevention coordinators, that's only a team of 8 people, but each of them reaches hundreds as well. There are 6 lessons that I want to touch on. One is partner engagement. We work in a reciprocal manner with our partners where we write a letter of support or participate in a grant review committee or review a provider messaging campaign, and then they in turn for us will provide feedback on a data product or we'll solicit updated data from our external partners. The second is transparency. All of the data on the opioid dashboard has been vetted, approved, and is ready for release, which makes it really easy for internal staff and our external partners to readily use the data and information that is available there. The third is availability. We put our contact information front and center on the opioid dashboard. Seems like a really simple step, but we received a lot of feedback that it's nice to be able to find a person's name, phone number, and email on a state site so easily. The fourth is credibility. When I'm talking to different sectors, there's something for everyone, from law enforcement staff to harm reduction to prescribers. There's content and resources on the opioid dashboard that is relevant to most audiences. The fifth is actionable data. We equip local communities with data and information to understand their local conditions so they can look at what are the drivers in their area, what are the levers of change. And the last is alignment. Through the broader work of the Data-Driven Prevention Initiative, we have collaborated across state agencies, developed an interagency grant matrix, and worked together to create the Opioid Action Plan, which was published by the Governor's Office on 2/14/18. Thanks so much.